It's really important to realize that managing type 2 diabetes and controlling your blood sugar does not mean you have to change everything about your diet and how you eat and what you eat. In fact, I strongly discourage you from radically changing your diet. One of the reasons I strongly discourage this is that we all have different cultures and we all have developed many different habits over our lifetime. Most diets can be effective as long as they're improved, not radically changed. I, for example, am mostly a pescatarian, meaning I eat fish and I eat vegetarian. Other people are carnivores, they eat a lot of meat. Other people are pure vegetarians. Other people are vegans. To radically change your diet, to go from one kind of diet to another, can be very difficult and it can be a little bit overwhelming. And I strongly recommend you not do that. And the reason I strongly recommend you not do that is because you need to gradually change habits over a period of time. So some of the things I want to go over with you is how you can control and manage your blood sugar and your type 2 diabetes without radically changing everything you eat. The first thing is timing, meal timing. One of the things that I do is I always make sure that I have protein in the mornings with and normally it's an egg or two before I eat anything else. I may even have bread and butter. I may have some carbs, but I'll always start it off with eggs. That protein, the protein in your diet at first substantially helps you control your blood sugar. The meal timing also does things like, for example, I'll add vinegar to my diet, and I'll make sure, for example, that during my meal timing, I try and eat no later than 6 or 6:30 in the evening. And the reason I do this is because I find that my blood sugar will stay stable during the evening hours and in the morning. It's a long time to have stable blood sugars. Very often when I check my blood sugar in the evenings, it's about 130. And when I wake up in the morning, it's about 90. Then maybe once a week or maybe every 10 days, I'll eat something special. I'll have some ice cream or I'll have something sweet that I don't normally have. And my blood sugars in the mornings will be 108 or 110. And this is a little bit above normal, but it's because I'm changing my pattern just a little bit, just out of boredom or just out of a change of pace. Another thing that's important to remember is that you want to control not how much you eat, but you want to try and watch what you eat. In other words, you don't want to just stop eating because you just think you need to stop eating, but you should pay attention to how much you're eating. It's easier for me because I've been taking Ozempic for 5 years almost. And I've taken GLP-1s for a long time. As I've told you before, I've had type 2 diabetes for almost 40 years and I'm 76 years old. So I make sure that I control my type 2 diabetes in ways that you may not. But what I do is I do make sure that I control my appetite. And one of the ways I control my appetite is with Ozempic. My appetite is curbed naturally. So if the doctor suggests that you take Ozempic or another GLP-1 or another drug like that, I encourage you to follow their advice. If you want to try and curb your appetite without doing that, at first for 60 to 90 days, most doctors or endocrinologists will give you that 30, 60, or 90 days to try and change your lifestyle habits with your diet before you go on Ozempic or another GLP-1. The most important thing to remember is start off your meals with a little bit of protein or vinegar. I have a tab of vinegar in my diet virtually every day, and it is shown through research that vinegar helps you lower your blood sugar. So these are a couple of things that's very important to remember as far as controlling your type 2 diabetes. if any of this resonates with you, I don't want you to understand that my type 2 pivot method program, you can sign up for that at any time, and I have a free guide which you can look up in my, and you can look and you can find that in my bio right below. So I just want to encourage you to take a look at the bio, and then you can also sign up for the free guide, and then you can sign up for the Type 2 Pivot program. And I'll go over in much more detail about how to control your type 2 diabetes long-term, perhaps for the rest of your life, with great control, like I do. Thanks, and have a great day.